Hello, everyone, and welcome to Database and Methods, the cyber seminar series hosted by VIReC, the VA Information Resource Center. Thank you to CIDR for providing technical and promotional support. Database and Methods is one of VIReC's core cyber seminar series, and it focuses on helping VA researchers access and use VA databases. This slide shows a series schedule for the remainder of the year. Sessions are typically held on the first Monday of every month at 1 p.m. Eastern. More information about this series and other VIReC cyber seminars is available on VIReC's website, and you can view past sessions on HSR&D's VIReC Cyber Seminar Archive. A quick reminder to those of you just signing on, slides are available to download. This is a screenshot of a sample email you should have received today before the session. In it, you will find the link to download the slides. Today's presentation is titled Ascertaining Veterans Vital Status of VA Data Sources for Mortality Ascertainment and Cause of Death. It will be presented by Dr. Chuck Maynard. Dr. Maynard is an affiliate investigator in the Department of Veteran Affairs, Denver-Seattle Center of Innovation for Health Services Research. He is also Research Professor Emeritus in the Department of Health Services at the University of Washington. In the past, he worked with VIReC to design and evaluate the VA vital status files. Trained as a sociologist and demographer, he has long-standing interest in the study of mortality and death databases. Thank you for joining us today, and I'm going to pass things over to Dr. Maynard.
Thank you, Erica. Thank you very much, Erica. Just a minute, see if we got the trying to get my slides to advance here.
Dr. Maynard, you just have to click into the slide and then it will advance forward once you click into it first, and then use the page up, page down key. Dr. Maynard, you are muted right now.
Thank you. We'll get this right one of these years. First of all, good morning, everyone. Before starting the presentation, I'd like to make this general observation that we are in exceptional times with the COVID pandemic, even though it is coming to a close. The things never quite work as you expect them to under these situations, and I guess with VA data, it's no exception. As we'll see, one of the files, the Vita status file, has not been updated since June of 2020. So please consider that fact as we progress through the presentation today. And also, please also, for information, the VIReC website is something that we all need to look at for updates and for understanding what's happening with VA data in these uncertain times. Okay. The first question is, what is your role in research and/or quality improvement projects? A, as investigator, PI, or co-investigator. B, statistician, data manager, analyst, or programmer. C, project coordinator, or D, other. Please describe via the chat function, and we'll wait for the responses to come in.
All right, the poll has been opened. The answers are coming in quite rapidly. For those who are just joining us, the poll should have appeared on the right-hand side of your screen. Once you select the answer, please hit submit. That's how the answers are recorded. All right, seems like things have slowed down quite a bit, so I'm going to go ahead and close the poll and share the results. We have 13% who said A, investigator, PI, co-I, 42% said B, statistician, data manager, analyst, 12% said C, project coordinator, and 8% said D, other. And some of those others are, oh, we didn't get any in the other to describe. So back to you, Dr. Maynard.
Thank you, Whitney. The second question. How many years of experience do you have working with VA data? None, 1 year or less. C, more than one, but less than three. D, at least three, less than seven. E, at least seven, and less than 10. And F, more than 10. 10 years or more, I'm sorry.
All right, the poll is now open. Our answers are coming in quite rapidly. I'll just let that run for a few more seconds before I close it out. All right, seems like everything has slowed down, so I'm going to go ahead and close that poll and share the results. We have 9% said A, none, I'm brand new to this, 13% said 1 year or less, 16% said C, more than one, less than three, 19% said D, at least three, less than seven, 6% said E, at least seven, less than 10, and 12% said F, 10 years or more. Back to you, Dr. Maynard.
Thank you. And that's very helpful to understand where the audience is with respect to VA data. Okay, so we're going to have this, first of all, we're going to look at the various data sources that are used for veteran vital status ascertainment. Then we're going to look at the VHA vital status files specifically, the relatively new date of death work group, and the master person index, and as death comes from there, information comes from there. Also, data sources for veteran and non-veteran mortality, other resources for mortality data, and then a couple examples of using mortality data for research. And this will be the third question, and that is, how would you rate your knowledge of methods to ascertain death dates for veterans in the VA from 1, no knowledge, to 5, expert?
All right, that poll is open. The answers are coming in. We'll just let that run for a bit longer so we can collect all that. Again, please remember to hit submit once you select your answer choices. If you do not hit submit, it will not get recorded. All right. Seems like things have slowed down. I'm going to go ahead and close the poll and share the results. We had 27% said A, no knowledge. 23% said B2, 17% said C3, 6% said D4, and 0% said E, expert.
Okay, thank you, Whitney. Okay, so we're going to talk first of all about the various data sources for dates of death in the VA. The first is the BIRLS, or Beneficiary Identification Records Locator System, which is part of the VVA databases, and so they have a great stake in finding out if someone has been deceased, because they don't want to give benefits to people that are no longer living. So this file does feed into the vital status file. A second, and one of the most important sources of vital status information, is the Medicare vital status file, which is available to the VA through VIReC, along with the other types of Medicare data. And we'll see that this file really produces the majority of death dates in the vital status file. The third source is very important source is the Social Security Administration Death Master File, which is really the only publicly available death file in the United States. It's basically a file of beneficiaries of Social Security in the United States, and it also feeds into the vital status file. And a third source is the medical SAS inpatient file, which basically records deaths for patients who died in the hospital. And it also feeds into the vital status file. And finally, the newest and probably now the go-to source for death information is the corporate data warehouse. You'll see this information referred to in various names. Basically, it comes from the MPI, which is now called the Master Person Index, which receives death dates from numerous sources, including the National Cemetery Administration. It also feeds into the CDW patient table, which it records the date of death. And as we shall see, this file has become the go-to source for death information in the VA currently. A little bit about the S-patient table. It includes the death date and time, and whether the patient had died or the individual had died. And again, this comes in from the MPI, or the Master Person Index. And we call it Master Person because not all patients in the MPI, not everybody in the MPI are patients. They may be beneficiaries who don't receive VA health care, or so it could be spouses or widows of who are receiving compensation benefits from the VA from a veteran who was eligible for compensation. A little more about again, the important part of the important thing that feeds into the MPI is the information from the National Cemetery Administration. As obviously you can see, this would be an important source of information that really wasn't available or wasn't feeding into the vital status file. And also the EVVE, Electronic Verification of Vital Events, is a national data system, which we'll learn more about later, which also is a very important information that feeds into the MPI. So now we're going to move on to the VHA vital status files. And this will be the fourth poll question. There's only one more after this. Have you ever used the VHA VSF? And you would answer yes for both master and mini, yes only for the mini, yes only for the master, and D for no use of either file.
All right, that poll is open and running. Our answers are coming in quite rapidly. All right. So the answers have slowed down quite a bit, so I'm going to go ahead and close down that poll. And here are the results. We have 10% said A, yes, both master file and mini file. 5% said B, yes, only the mini file. 2% said C, yes, only the master file, and 53% said no.
All right, thank you. Thank you, Whitney. So first of all, many of you have not used this, and even though the file hasn't been updated in the past year, you're still going to want to use it for your studies, particularly if you're looking for deaths that occurred, prior to 2020. So a number of years ago, we did a study that kind of concluded that if we combined these various data sources, BURLS, CMS, SSA, and the patient treatment file, we might be able to do a pretty good job of ascertaining vital status. And we compared that with the National Death Index data and found that we had quite high sensitivity. So this study really led to the development or the instigation of the vital status file. And here you'll just basically see that it really has two files, a master and a mini. We'll understand a little bit very soon about how those are constructed. It is updated quarterly, but again, we need to emphasize that it has not been updated since June of 2020, and we're not really sure when it's going to be updated next. This is kind of in the hands of national data systems, which is not, it's more than just research. So I can't tell you much more than that right now. Okay, so here's how the file is constructed. Basically, it's merged on the Social Security number, the date of birth, and sex, be the male or female. This information is obtained from a variety of VA sources, and also from, now here we use the term MVI, Master Veteran Index, which is basically the same as a Master Patient Index. And so we're going to merge these using these three identifiers with the actual deaths and see if they merge on date of birth, sex, and date of death. And so it's possible to get more than one match. So there are basically two files. There is a master file, which has the best date of birth, SSN, and sex, and there may be more than one of those combinations for an individual. And there is more than one per SSN. And there's also a mini file, which is only one record per SSN. So it is a unique file, whereas the master file is, you could have more than one entry per SSN. So we've had previous presentations on this by Noreen Arnold and Claire Hoffmeyer in 2015 and Elizabeth Tarlov in 2014. And since that time, I have done the last 6. So these are all archived and available to you if you want to consult them. So working with the VHA vital status file. Now these are these are not the latest figures. They're probably about a little over a year and a half old, but so the numbers will be increased. But basically, the master file has many more variables than the mini file. It includes veterans and non-veterans, whereas the mini file only includes veterans. And again, we have this one record per SSN in the mini file and one record per the SSN date of birth sex combination in the master file. And of the some 31+ million records, 39% of those SSNs have more than one of those combinations of date of birth, sex, and SSN. There are roughly, now there's probably closer to 20 million unique SSNs in the mini file. So here are the variables in the mini file. So we have the activity, the last activity date, the indicator of that date, its source, and again we have the best date of birth, the best date of death, presumed living indicator, which is really important if you're really just interested in whether the person is alive or not. And then we have the utilization dates. We have some cases where there are actual deaths that occur, where there's utilization after death. And we'll talk a little bit more about that in the next couple of slides. So here are the sources of the best date of birth. And as you can see, most of them come from the what we now call the MPI, not the MVI, over 16.4 million. So it's over 80%. With respect to death, it looks like most of the deaths are coming, most of the best dates come from Medicare, which is not surprising given that Medicare is older individuals and people are more likely to die when they're older than younger. So the Medicare data is a really important source of information, as is less important, but still is the Social Security Death Master File. So we have some challenges in using the VSF. And a lot of this is going to depend on how big your files are, how many are in your study. If you just have, a couple hundred, then you may be able to spend a lot more time trying to, work with some of these challenges. Whereas if you have really, really large files of, say, hundreds of thousands, and you're going to have to make some rules about how you determine whether someone's dead or not. So it's possible that the demographics don't match. Suspect that they might have a different sex than what you expected. There may be multiple dates of deaths. There may be activity after date of death. And some of that is perfectly possible. You know, there may be a bereavement appointment for the family after someone has died. There could have been other things that would explain why that's the case. However, if you find that there's an activity that's, say, more than a year after the date of death, then you might begin to wonder whether the match is indeed a correct one. And there, of course, there are erroneously recorded dates of death in these sources. And it is possible that the date of death was, you know, that somebody was mistakenly identified as being deceased when they actually weren't. Again, emphasizing the VSF has not been updated since June of 2020. And also the note below that the VSF should not be used for business operations regarding individual veterans. So that this really goes to the heart of the question of, you know, benefits and, you know, whether you, what is your source for assessing whether someone receiving benefits is indeed dead or alive. So there are challenges in using the VSF. Again, probably the most important one right now is the fact it hasn't been updated recently. So we have some strategies for cohort matching. You can use the master file to maybe read out some of these situations where the mini file kind of produces something that doesn't make a lot of sense. Again, we have the activity after death. And it is possible to use supplementary data sources such as the National Death Index or State Vital Statistics Office's death certificates. Although as we'll see, some of these have limitations. And again, you're probably only going to want to use these where you really have relatively small studies and you're really concerned with tracking individuals. If you're, you know, where you only have maybe 1,000 or so deaths in your file. And again, using CDW, and here again, we're referring to the Spatient or the MPI or whatever it is. You want to use that as well, especially for trying to assess vital status in the last year. So we're going to talk a little bit about the Spatient or also the Master Person Index and the Date of Death Work Group. And this is a final poll question. Have you used the Spatient table in CDW, or also are you familiar with the Master Person Index? Yes or no?
All right, that poll is now open. Just gonna let that run for a few more seconds before we close that out. Okay, it seems like things have slowed down quite a bit, so I'm gonna go ahead and close that poll and share the results. We have 32% said A, yes, and 35% said B, no.
Great, thank you, Whitney. And that's actually a little higher than I expected, so that's good to know. Okay, the Date of Death Project. It's very important to understand that this started as a Date of Death work group, and it involved leadership from the three agencies within the Department of Veterans Affairs, VHA, Health Administration, Benefits, and the National Cemetery Administration. Its purpose was to improve VA ascertainment and documentation of death of individuals known to VA. So it's not just those who receive healthcare, but there are many who receive benefits and don't use VA healthcare. So having an overall, you know, strategy for assessing deaths across the three administrations is really important. And so they have developed the processes and procedures to improve the accuracy and completeness of the date of death. The Master Person Index is now the authoritative service for date of death. And also, as we said earlier, the EVVE is now in use in VA. And a little bit more about the EVVE. It is under the auspices of the National Association for Public Health Statistics and Information Systems. It's an online query system of state vital statistics databases, including death certificates and birth certificates. And the VA now participates in this. So they actually have access to the birth certificate. I'm sorry, the death certificate, which is really more concerned here for veterans. So this is kind of a timeline. It's the MPI, or I think back then it was known as the MVI, was started in August of 2017. It was originally seeded with deaths from Vista in 2017, fall 2017. And a really important date was in November when it started to receive files from the death information from the death master file. And now it pretty much currently it looks like its capture is very complete, in that it kind of gets information from Vista, but it also feeds information back to Vista. So it is, as I said, it's now considered to be the source, the go-to source for death information, not just for research purposes, but for the purposes of determining whether a beneficiary is alive or not. So here's a kind of a graphic as to how this works. So the MPI, the Master Person Index, accepts dates of death from the SSA DMF weekly file. It also receives deaths from the National Cemetery Administration, the DoD, and those deaths from Vista as well. So that's fed into the MPI, and then the MPI is pushed back out into the Vista records. And from that, in the CW, it's also populated in the Spatient table. So there are a small percentage of deaths in MPA that are not in Vista, and vice versa. And those are being resolved by the Healthcare Identity Management Office. Again, if you really want to assess current deaths, it's really important to consider, it's essential that you use the Spatient table. A little more about the EVVE. This is a really important tool in that it's a national tool, and it would include veterans who may have been known to the VA but did not use healthcare, or had minimal use of benefits. And here the conclusion is the VHA vital status file can be used to augment the MPI to capture the small percentage of deaths that may not be in MPI. And for more information on this, I refer you to Noreen Arnold's excellent recent report from last January about the comparing the VSF and the MPI. Now, the link is provided below. It's only available on the VA intranet, so the link should work. If it doesn't, go to the VIReC website, and I think you can get it from there. But last time I checked, this link did work. So sometimes you can't be sure about these links, but this one should work. And encourage you to look at the report to get more details about the comparison of these two sources of death. So now we're going to move on to data sources for both veterans and non-veterans. And so for research purposes, the National Death Index has been the gold standard for death ascertainment for quite some time. It does include deaths from 1979 through, I believe, the 2020. There is an early release right now. There is usually a lag of 12 to 18 months. But the important information on this, in addition to the vital status ascertainment, is it does include the cause of death. Now, it does not include the whole death certificate. It only includes certain items from the death certificate, mainly things like race and the date of death, and probably also of importance, the underlying cause of death. And there is a fee structure involved, and the link to CDC can tell you more about that. Now, there's also a national death index for veterans, which comes from the CDC NDI Plus. It is for veteran decedents only and includes all causes of death. And generally, there is a bit of a lag time. Usually, it's a little bit longer than what is the case for the NDI for the general population. But it is important because it does include cause of death information. It's also a way to verify, vital status in patients where you're not quite certain. The drawback is that I believe we're right now looking at only 2018 as being the last available date. I'm not sure when 2019 will become available, but you can find out more by going to the VIReC website. And also, you might, as we'll see here, you can contact the data steward for the National Death Index for veterans. So as you can see, it is on this slide, the email address for the data steward at Canandaigua. There is an application process to use the NDI, and it undergoes review, requires IRB approval, among other things. So that's more information about that. And if you're interested really in cause of death, this is the way to go, because there's no fees associated with this, whereas with the NDI there are fees. There is a special Social Security Administration epidemiological search, which is a little different from the Death Master File. It will get you maybe a little bit more if you really have some hard to find patients and you have the resources. This may be something that you want to pursue. There are fees involved, and more details can be obtained by going to the link on the SSA website. There are also state death certificates. The state's policies regarding the release of death certificates vary considerably, as deceased individuals are not considered to be human subjects, but there are different interpretations of the HIPAA rule. A couple of years ago, I went through and did a review of all the state vital statistics offices, and looked like there were about 24 that had some kind of process for obtaining death certificates for research purposes. So there are some advantages to using these. The veteran status is reported on the death certificate, so you may get veterans who have no affiliation with the VA. It does include the whole death certificate, so you get things like contributing causes, not just the underlying cause of death. You get things like place of death. You get a whole set of information that you wouldn't get from just the NDI Plus. The disadvantages are, number one, this is the lag time. These are going to be at best probably a year and a half to 2 years lag time. So you wouldn't get 2020. You probably wouldn't get 2021 until next year probably, at the earliest. 2022 or probably into 2023. And of course, there are always concerns about the accuracy of the information on the death certificate. But if you really want to do a detailed look into cause of death and circumstances of death, this is the place. This is where you probably want to go. There is also the Defense Manpower Data Center, which has some interesting information. That it actually has the names of individuals who died in the Iraq and Afghanistan conflicts, where they believe it has their last state of residence. So it is possible to use this information to do some research studies. For example, we looked at the Association of State Per Capita Income and military service deaths. So this is mainly aggregate stuff. You're going to do this for research. You're not going to use it to identify veterans who've deceased, because the casualties in the DCAS are basically ones that occurred in the theater of operations. Okay, so there are other sources. The CDC has a number of death search tools as well as limited individual death files. So again, you're going to use these for research purposes. Again, you're not going to use them to determine whether an individual has died or not, but the CDC Wonder has an underlying cause of death search tool, which allows you to do aggregate information about cause of death. You can look at it by age or race or other characteristics. Again, the same provisos about lag time apply here. I believe they have 2019 on right now. It's either 2018 or 2019. So if you were going to be interested in COVID mortality cause of death, you wouldn't be able to get that from this. But in a short time, you may be able to in the next few months. There are individual level multiple cause of death files that go back some years if you're interested in doing research on, not how there are different causes. There are multiple causes of death. There's an underlying, and then there's these contributing causes, and trying to sort those out. So again, these have very specific purposes and probably are not going to be of great use to you. There's also this web-based injury statistics query reporting system, Whiskers, which the CDC also runs. Again, it's if you're really interested in deaths due to injury, such as drug overdose or even suicide, these will give you some aggregate level information. Some of the benefits of additional mortality information. This is 2012. 10 years later, there's a lot fewer veterans than there were, and there are still many that who are veterans but may not be known to the Department of Veterans Affairs. So using these state death certificates may be of interest here. But again, they probably have limited applicability to what you're doing. Some of the things you can do: study the whole general veteran population, as we said. Compare veterans who use VHA services prior to death versus those who don't, and comparing veteran and non-veteran cause of death information. That all can be done, but again, I think the applicability is somewhat limited. A couple more recent examples of studies that we've done. Joe Simonetti used the National Death Index for Veterans to look at characteristics and injury mechanisms for veteran primary care suicide decedents with and without a diagnosed mental illness. Interesting finding was that those who died by suicide, primary care patients, about half had no antecedent mental health or substance use disorder diagnosis. And a second paper more or less verified the finding, which is pretty well known, that white non-Hispanic males, middle-aged males, are at increased risk of death due to poisoning, alcoholic liver disease, and suicide. We found this to be the case in the veteran population as well. And again, here's a third example of using Washington State death certificates. Washington State is unusual in that it actually has death records available for purchase, and it completes the whole death record, $20 per year. You have to sign a data use agreement. I think right now the Department of DOH in Washington State have been on a hold in terms of releasing these death records, but I imagine they'll be back in business here fairly soon. So again, it's one state, but for a relatively cheap price, a relatively low price, you can get a lot of information, a lot of death certificates, and research questions that may be of interest to you. There's a whole host of questions that can be addressed with these very complete death certificates. And I believe right now they do have the first 2 months of 2020. There are some studies that were used that have been published in the past 15, 20 years using Washington State death records. Here's a kind of cheat sheet that basically goes through the data sources we've described in the last half hour. So the Burroughs death file, the VA CMS Medicare vital status file, the SSA death master file, the patient treatment file, the corporate data warehouse. Again, these first 4 are part of the vital status file. The last is not. And we've used various names. The patient table is probably going to be the one that's most important to you, but also the master person index is also which kind of feeds into the patient table. So that's a really important source of ascertainment, particularly for current deaths. We have the National Death Index, which is for veterans and non-veterans. There is the NDI for the general population, and also the NDI for veterans, which is an important source of information, particularly if you're interested in cause of death. And we have the SSA epidemiological search, which is also out there, not likely to be used, but it is available. And finally, we have state death records. Various sources of information. We have, VIReC, which again, I can't emphasize enough. It is the go-to source for VA data, and also will give you the most current information on the death ascertainment in VA. Again, if you really want, you need to go to the internet in order to get the complete package. The internet package is pretty bare bones. Also, the VHA data portal is another important source of information for VA data. And at that, I will stop and ask for questions. And thank you very much for your attention, and we'll see what we can do with your questions.
Yes, so we already do have some questions. Feel free to keep putting your questions in the Q&A, and we'll take as many as we can, because we have plenty of time. So the first question is, for the roughly 98% sensitivity for combined sources of death in the VSF, is that for a binary death, yes, no, or for the specific date of death?
It's for the binary death. And I should also tell you, this study was done, it's been almost, it's been a little less, it's been 15 years. It probably needs to be done again. Yeah, so it is for the yes, no, whether they were dead or alive. We did look at date of death and did some, the paper has more details on that. And the dates of death for the most part were pretty close.
Okay, I think you sort of answered this question, but you are using MPI and MVI interchangeably. In the CDW, I only see MVI tables. Are these the same?
Yeah, I'm sorry about that. I'm not all up to date on all the nomenclature, but the MVI, Master Veteran Index, Master Patient Index, they're basically the same thing, or Master Person Index, I'm sorry. It all gets down to, there are those people who are not veterans that the VA does pay benefits to, and in very unusual cases also provides health care. So I think the word person is used, but I think we're given that most of you your research is going to be about veterans, I think the MVI is basically the same thing.
Okay. It seems that there are multiple sources of death data. When they disagree, which one do you use?
Good question. I would, first of all, among the VA sources, I would go with the patient table, because what's happened is that the leadership is really concerned about identifying individuals and making sure that they are alive to receive benefits. So that is going to be the most accurate source. I would also put a lot of trust in Medicare, again, for the same reason, that Medicare does not want to be giving benefits to people that are no longer alive. Particularly in this day of COVID, when you got to believe that there have been delays in the reporting of deaths, and so I think that the general advice is to beware and to realize that things are different now, and that the information may not be as complete or as accurate as we have expected in the past.
Okay. Could you elaborate on the difference between contributing causes and the underlying causes on death certificates?
Yes. That's a good question, and it's a difficult one to answer because a lot of it depends on who fills out the death certificate. If a patient dies in the hospital, it's likely that it will be completed by the attending physician, and they may have in their mind that there was the underlying cause of death was the immediate cause, or the cause that led to the death, but there were also contributing causes. And for many people, that may be, older people that die of chronic disease. So maybe they died of lung cancer, but maybe they also had coronary artery disease, hypertension, diabetes, and they may have contributed to the death. So it's kind of a hierarchy. The contributing causes, there can be many, and they're not ranked, but the underlying is kind of the cause that was the immediate one. Now, you also have a situation where in many parts of the country, cause of death is can be completed by the funeral director. And in that case, who knows? It may be a best guess as to what caused the death, and they may have limited information regarding what might have been contributing causes. So, and I'm sure this varies by state and by locality. So I guess I'll leave it at that, and just that's probably the best I can do with that question, which is a really good one, and we could probably spend a lot more time on it.
Okay. Is the S patient table suitable for deaths before 2017?
Good question. I would think it is, but here, if you're really looking at earlier deaths, I think you want to use both sources. You want to use both the VSF and S patient. So that's one case where you really want to use both sources. I don't think you can assume that they went and backfilled all those dates of death.
Okay, we have someone who wants to thank you for a terrific presentation, and they have a question. Are there any mechanisms you can propose for researchers using VA CMS data to find or access mortality data for those non-veterans in the CMS standard analytical file?
Good question, and I'm not sure I'm the person to answer this. You probably should contact ResDAC, the regional data, or you may want to contact someone at VIReC. I would think that you would be able to get the Medicare vital status file for those individuals who were non-veterans, and you want to find their vital status. I think that would be available through the Medicare vital status file in the general population. But I think you probably need to go to ResDAC or either the CMS website to find more information on that. I hope that addressed your question.
There's a clarification of, can we use the, it's Benny_death_DT in the MBSF file? Does that make sense?
You're saying this is for the last question, is that correct?
Yeah, it was a clarification, I believe.
Yeah, there is, you can get so VIReC handles all the Medicare data requests, and I believe you can get the specific vital status information from VIReC, yes. And that would only be for veterans, though, only for veterans that use VA healthcare. For veterans that don't use, for veterans that are, most veterans, you're going to get most veterans that way, but for non-veterans, you're going to have to go to ResDac to find out the answer to that question.
Okay. There's another thank you for the very helpful overview. And what method would you recommend to assess vital status and date of death for a multi-state clinical trial when we'd like to know deaths through June 30th, 2021? P.S. It's a clinical trial of veterans only.
And I'm assuming you're not able to, you don't have the resources to access, to actually go out and follow patients. So then for this one, I think you really want to use Spatient, the Spatient table or the MVI. That's going to give you the most current information. And I don't know how many patients you have in your study. The other strategy would be to is to make phone calls or to another possibility, which is a great source of information, is just using the internet, using Google or using Chrome or any of the Microsoft browsers, and there are obituaries that you use to search on a person's name, and you'll be surprised how much information you may find from just using those kind of blunt search tools. Ancestry.com is another possible source, although there's likely to be lags. But I would really encourage you to, and there are obituary, I believe there are in some of the university libraries, there are obituary files, but just using entering a person's name can produce very good results in a lot of cases.
Okay, great. So why isn't the MPI in CDW Spatient table included in the VSF? That's question one.
That one I probably can't answer for you. I think it would be, I don't know where we're going. See, VIReC was really the people at VIReC, Denise Hines and when she was the director, and Noreen Arnold were really the people that kind of gave the impetus for the VSF. And this was coming from research. It's a little more complicated now because the operations, the folks at the leadership and the non-research folks have gotten involved, and I think this is something NDS, National Data Systems, is probably working on. But my guess is that eventually Spatient will really be the source, and that VSF will kind of gradually go away. That's just a guess on my part. And what's concerning is the VSF has not been updated in about a year, and I don't understand why that is the case. I'm sure there are good reasons for it. There may be delays in some of the data sources. Medicare could be delayed. I don't know about the death master file, what's going on with that. But the COVID's really brought a lot of data sources to a slowdown. I hope that addressed your question.
So second question, are DMDCs, DCAS, casualty KIA deaths not provided through the DoD source into MPI? I can reread that again if you need.
As far as I know, they aren't. And the reason probably why they aren't is that these are guys, if you define a veteran as someone who has left military service, is no longer active duty. So these are basically all active duty people. Now, they may have been veterans at one time and re-enlisted or whatever. So it's probably not, these individuals are probably not going to be known to the VA. There might be a few that are, but most of them aren't.
Okay, just a couple more questions. Sometimes there's a discrepancy in dates between MVI and Spatient. Which would be considered the authoritative source?
Good question. And I think a lot depends on how far the dates are apart. If they're just a few days, I think you go with what makes sense to you. I guess I would rely mainly on the MVI, but it's when you get dates that are farther apart, when they're maybe 6 months or a year apart, and then again there may be just entry errors. It's if they have the same month and day in a different year, then you've got to ask yourself, well, somebody must have made a mistake in entering the date year. Or you can also just look at utilization to see if they had utilization after a given date.
Okay, so last question, I believe. I maintain one of the VA cancer registry databases, and my understanding is that we are not allowed to perform Google searches on individual patients because it violates VHA privacy rules. Are there any such concerns when using the sources listed here for ascertaining death information on individual patients?
I'm sorry, Eric, I didn't quite hear the last part of the question.
Yep. So are there any such concerns when using the sources listed here for ascertaining death information on individual patients?
Well, I don't know how to answer that question. I think that's kind of beyond my pay grade, to be honest with you. I would say the sources here, I mean, if you have IRB approval and you list these sources, I don't see where there's a problem. And I wouldn't see where there's a problem if you used, if you were to use the internet list the internet as a possible source of death ascertainment. I mean, as long as you're saying what you're using, I don't know. That's my understanding of HIPAA, but I'm not the authority on this, so I would have no concerns from a privacy standpoint of using any of these sources of information for death ascertainment.
Okay, Dr. Maynard, that's the last question for now. Thank you for taking the time to present today's session. To the audience, if your questions were not addressed during this presentation, you can contact the presenter directly. You can also email VIReC Help Desk at virec@va.gov. Please tune in for the next session in VIReC's Database and Methods Cyber Seminar Series on Monday, July 12th. That's the second week of July at 1 p.m. Eastern. John Radden will be here to present CDW, a conceptual overview and SQL introduction, and we hope to see you there. Thank you once again for attending. We will be posting the evaluation shortly. Please take a minute to answer those questions and let us know if there are any data topics you're interested in. We will do our best to include those in future sessions. Thank you so much and have a great day.
Thank you, everyone.